Presentation on veterans and their families and the need for holistic medicine and integrative health, and this is for the class Composition 2. Veterans and their families have served this country since the beginning. And since the beginning, health services are essential, but at a minimum, to provide health care to veterans and their families that are suffering from stress and trauma. This is just not physical damage that has been sustained. As a result, more holistic options have been offered. However, they are in short supply and have not covered or not covered by insurance since 9/11 has happened. Previous conflicts, trainings, and deployments have continued on several fronts since then. The physical and psychological pain these individuals suffer needs integrative medicine, not just modern medicine. One of the sources was a grant proposal for veterans needing to learn transcendental meditation after deployments. But this also goes for their families needing that care also. This The transcendental meditation helps to regulate emotional trauma, the other source of healing. Veterans and their families need to be able to utilize support resources to address their mental health and improve their quality of life after a deployment. Other sources go over holistic medicine among veterans and their families. Another one goes over examining conflicts and what their families endure in the stages of deployment and before the physical trauma and disorders even occur. I also outline the challenges veterans and their families face after physical and psychological illnesses, and then explain the conditions presented, treatments, therapies to help them recover, and types of interventions supplied by support networks. So we'll go ahead and get this window started. All right, the introduction. Veterans and their families need holistic health and other integrative care options alongside their primary care. Veterans and their families need to be able to utilize support resources to address their mental health and improve their quality of life after deployment. Holistic health and integrative healthcare options are at a minimum and not provided. So what ends up happening, even before deployment happens, we show the stages of deployment and trainings that these soldiers and their families go through. So you've got the physical, mental, and emotional trauma. A lot of families end up suffering like emotional traumas right before deployment because of all the information they're being fed at meetings before their military member deploys. And that's usually where everything starts if it's not at the trainings that they go to prepare them for deployment. Then you have deployment. These soldiers and their families, when they're able to communicate, sometimes they'll hear something in the background, and that'll cause a trauma for the family, knowing that their soldier's not safe. Or the soldier ends up suffering injury, and might not even injury, just the event that ends up happening when the conflict's going on can emotionally and mentally damage them if they don't end up getting physically damaged by the deployment in any way. Then you have post-deployment. They come home, everything seems fine for a couple weeks until it's not, and they go to a function or just on an outing, and something triggers them that is similar to what happened in that deployment. And then the family ends up suffering from that stress and trauma and not knowing what to do as a unit. And they want to help their their military member heal, not knowing that they're also suffering too, trying to help their military member. Then you have trainings that usually happen before deployment, where you end up having casualties before they even go to this foreign country or wherever they're going. And that ends up causing physical, mental, emotional trauma, them being without a military member before they even get into a foreign country. So here's a quote that I have from one of the dissertations. There are currently over 20 million living veterans in the United States, and many who have served or have served in combat and experienced mental health problems. Throughout the separation process, family members must assume new roles at home and often experience an increase in anxiety and worry about their loved ones serving in combat. Only recently have military organizations begun to fully recognize this lifestyle impact on service members and their families. So I'm going to go over usually the majority of what ends up happening after these deployments or before the deployments or during trainings or after deployment. So you've got physical, mental, and emotional trauma. That's a big one for a lot of them. PTSD, morale injury, suicide, depression, anxiety, substance abuse, which in my experience I've seen a lot of growing up as a military brat and a military spouse, and with friends that I've known too. Traumatic brain injuries and other physical injuries. The need for holistic health care and integrative health care alongside their primary care. The only treatments that usually you get from your primary care are the counseling, clinical hypnosis, EMDR, which is eye movement desensitization therapy, prolonged exposure, which is having the individual not relive it, but go through the experience, which it sounds like relived, but being able to act in a more rational manner as they go through the exposure therapy. You have biofeedback and medication. These are good as long as the individual is going to seek care, but sometimes we don't get that. And it ends up failing, or there needs to be more added to it for it to thrive. With the therapies that are being offered, that they're now recognizing they need to add with those treatments that they're doing, transcendental meditation. Here's a quote showing how veterans responded to receiving transcendental meditation. A well-received controlled study of veterans with post-traumatic stress disorder compared to the practice of TM with prolonged exposure therapy and PTSD health education. The research have found significant decrease in severity of PTSD symptoms in veterans who have learned TM. So the physiological effect that the PTSD from the traumas that from trainings or deployments with those treatments that they're providing is helping as far as their physiological body, their mental and emotional health, so they're able to find their new normal. You also have acupuncture, which helps with the physical trauma, and even the physical trauma can cause this emotional or mental distress. Tai Chi and Qigong are great ways to help release those physical traumas and those mental and emotional traumas through practice. Yoga is also a wonderful release. Massage therapy is, because we hold so much of that trauma in our bodies and it needs to be released. Ayurveda is it's lifestyle, diet, routine with consciousness. Also, that consciousness is transcendental meditation, which is a great combination with the yoga. All right, and here we go. The practice of holistic medicine is incorporating the biological, physiological, sociological, cultural, and spiritual aspect of the person with the focus on the whole person and realizing that this whole is greater than the sum of any part. Complementary and alternative therapies take into account the whole person, mind, body, and spirit. And that's just showing how the treatments and the therapies coming together that person can try to find where they fit in after serving our country. And so many have issues trying to find that balance, and it just helps when you have unlimited resources to choose from to see what'll work for the military member and their family so they can heal. All right. So there are organizations that are working on this. Here's a few of them. Veteran Affairs. Here's a quote from them that they started this program. It's not very old, but I guess they started noticing more after 9/11 that they needed to have something more than just the treatment because just treatments weren't working. But here's a quote from one of their individuals that works there. The whole health approach equips people to take charge of their health. However, this requires change in how we think about healthcare, where clinical care is only one piece of the system and not necessarily the centerpiece. This change of thinking is the transformation we are making across the VA. So those therapies, along with those treatments that were listed on the other page, they started to notice that they needed to do more. It's just with the VA, it's after stuff has already happened, and some of them are seeing that things like if TM or Ayurveda were there before the soldier, or yoga or Tai Chi, any of those were there before the soldiers and the families had to go through a deployment or a training, they probably would have been better prepared physically, mentally, and emotionally. Shields and Stripes, they offer TM services. David Lynch Foundation, they offer TM teachings. TM for Veterans is just geared towards veterans, not the family. A Station Foundation, they're geared toward, they have several programs. They have for the family, for couples to just reintegrate them and they use yoga and just nature walks, and they have counseling. I know for a fact that one of the TM teachers has gotten with Station Foundation, and they're trying to work that into there too. So we'll have TM everywhere, which is wonderful. All right, so breaking the stigma. Trying to get the veterans and their family support has been hard since the beginning of this country, because for the longest time, you just push it off like everything's okay, you'll get over it. And trying to get the veteran to get over that stigma of everything's okay, or I'll still have employment, or will insurance cover this, or will they end up committing me like I'm not doing well and I might not fit into society because I did all the things I did in the service of my country. There's a whole list of things that trying to get the individuals that need the help out of their head to go get help and to have that support there is crucial. And in doing this, we need to have the research about holistic health and integrative health to be able to educate not only the providers, but educate these individuals, the veterans and their families that need help. There also needs to be more funding towards it. Like we have the fundings for the deployments and the trainings, but we are lacking funding and supporting the veterans and their families to make this obtainable so they can get the support options that work for them. So, in conclusion, veterans and their families need a holistic and integrative healthcare option. We need to understand the stages of deployment, how physically, mentally, and emotionally it affects them, the need for holistic health and integrative health alongside their primary care, and understanding that stigma, having people there that know how to talk to them to get them to understand and be caring and have grace and understanding to be able to bring them in to get them in a healing process. The need for holistic healthcare and integrative healthcare to allow veterans and their families to heal from their physical, mental, emotional injuries and to live everyday life again is so important. And if we could just, there are people out there like that know that they need help, but it's getting everybody together to find out what works, or just having little groups get together makes it so important for the military community. But I've got my references here, and that is all for my presentation on veterans and their families and the need for holistic health care and integrative health. Thank you.